Hello, and thank you so much for inviting me to present at the Pink Empress conference in Nigeria. I am so sorry that I was not able to join you in person nor over Zoom in real life, but I am very pleased that I can present just a few words for your consideration today. So again, thank you so much for the opportunity. I really am very flattered to be asked to present. I was given the topic of survivorship, achieving no evidence of disease after breast cancer treatment. And I know that this is a topic that is very near and dear to many of your hearts, especially as you're facing this diagnosis and wanting to live long and healthy and happy lives. So these are my disclosures, none of which are particularly relevant for today. So as I was thinking about today's topic, I started thinking about what we mean by no evidence of disease. Now, clearly, what many people think of is the fact that year after year after year after year, whether you had early breast cancer or metastatic breast cancer, when they do scans and mammograms, that they don't find any evidence of cancer recurrence, that there is no evidence of disease. And certainly these days, this is achievable when we use scientifically validated, evidence-based therapies. And newer ones are being developed every day as we learn more about the genomics and the molecular biology of cancer, and as we develop new drugs and new therapies that are helping our patients to live longer and better lives. Certainly, by participating in clinical trials, you can have tomorrow's therapies today, and you can help to push that boundary forward. So certainly that is one way to have no evidence of disease long term. But as I thought about this topic, I thought, let's take one step back and think about how we got the disease to begin with, because certainly prevention can allow us to live long and healthy lives with no evidence of disease if we never got breast cancer to begin with. And so when we think about prevention, I often think about primary prevention. How can we prevent ever getting cancer to begin with? And I think that there are a few things to keep in mind here. The first is to know your risk, whether that's your genetics, your family history, knowing the risk factors, and then being proactive in terms of managing those risks. So how can you reduce risk factors? Well, you can avoid alcohol. You can maintain an ideal body weight. You can avoid exogenous hormones. Certainly, there are some risk factors like being a woman, getting older, which we can't really control. For some patients who have a very strong family history or a genetic risk, think about chemoprevention, taking endocrine agents that can reduce your risk of ever developing cancer. In fact, cut that risk in half. And for those who are at very high risk, thinking about prophylactic surgery, which, while a surgical intervention, maximally reduces risk. Well, what else can we do to have no evidence of disease long term? Well, secondary prevention also helps. So this is the whole idea of screening and early detection. And whether that is with mammography or whether that is with clinical breast exam, this idea of finding cancer early when it's most treatable is very effective, because we know that if we find cancer early and we treat it in its earliest stages, that the outcomes are much better and patients live long and healthy lives with no evidence of disease. And finally, there is tertiary prevention. This is the idea of preventing side effects of disease. So managing metastatic symptoms so that during our lifetime, we may have physical disease that's seen on a scan, but we don't suffer the consequences of that disease, that we don't have all of the negative side effects of the drugs or the pain of the metastases. And this is important too, because it's not just the quantity of life, but also the quality of life that is important. When I was thinking about no evidence of disease in terms of survivorship, well, many of us think about this as being simply no evidence of disease on a scan, focusing on the body. I think it's important to take a holistic standpoint. What does no evidence of disease mean in terms of the mind, in terms of the soul or the spirit? Because truthfully, the diagnosis of cancer has ramifications that go far beyond the physical. So, how are you dealing with having no evidence of disease in the rest of your life? Are you always worried about cancer recurrence? We know from studies in survivorship that that's one of people's number one concerns. And for many people, that can be very anxiety provoking. So, what are you doing to help yourself to take proactive steps to reduce recurrence, but then also focusing your mind on the optimism of living a long and healthy life? Are you surrounding yourself by people who lift you up and who support you through your journey? We know that for some people, there's an existential crisis that goes along with a cancer diagnosis. People think about, what happens if I die? What happens on the other side? What happens to my children? Am I ready for this? And so, what steps are you taking to think about all of that? Now, I know that that can sometimes seem like a morbid conversation, but I want you to think about survivorship writ large. So, how can I live my best life with no evidence of disease, no evidence of disease in my body, with the help of the latest medicines and therapies, and finding cancer early so that it's most treatable, taking those proactive steps to really use scientifically based, evidence based, trial proven therapies, but also thinking about living your best life in terms of being worry free as much as you can be, surrounded by people who lift you up, and really being at peace with your life and your diagnosis as you move forward. So thank you again for inviting me here to share a few thoughts as you kick off the Pink Empress conference. I would have loved to be there with you in Nigeria, or at least over Zoom, and I hope to reconnect with you in the future. If I can be of any help to any of you, please don't hesitate to reach out, and I wish you the very best of your conference.